Hello, Mr. Rye. My name's Melody. I'm going to be your dental assistant today, and I'm going to be teaching you about oral hygiene education.
Hello.
So a few moments ago, I had you chew up a disclosing tablet. That disclosing tablet is going to reveal to us areas in your mouth that you're missing with your brushing. So those areas are going to be colored pink for the type of disclosing tablet that we used. The pink areas indicate biofilm, which is a fancy word for plaque. So what I do is I calculate how many areas I see with pink, and then we can find out how many areas of your mouth are biofilm free. And then we can know where we need to work on to improve. So I'm going to show you the areas of your mouth that are showing pink. Okay. If you look right here and you see all of these dark pink spots and pink in general, see on the fronts of your teeth, those are called the facials. They're showing pink, so you are missing part of the facial of your teeth, but it looks like on the top of your teeth towards your gums, which is called your gingival margin, you are doing well. I'm seeing a lot of dark pink in between your teeth, called your interproximal surfaces. So it looks like we need to work on improving the areas of our teeth in between, which can be improved with our dental care, flossing, and brushing, of course. It looks like we need to work on our in-betweens a bit more, so that will entail our flossing routine. Your facial surfaces, the fronts of your teeth, look pretty good on the tops by your gums, your gingival margin, and the bottoms, it looks like you're missing a little bit, but not too much. That can be improved. Okay, so now that I've explained to you what the disclosing agent does and doing the score shows that you have a 55.3% biofilm-free, fancy word for plaque, score in your mouth. So 55.3% of your mouth has no plaque, the rest has plaque. So we ideally want 100% biofilm-free, plaque-free, but just like a test, 90% is acceptable. So it looks like we can improve. So I'm going to go over some ways to improve that score to better your overall hygiene health for the future. Okay, Mr. Rye, can you show me your toothbrush that you use?
This is my toothbrush.
Okay, so I see you use an electric toothbrush. Does this electric toothbrush have a built-in timer with it?
Yes, I think it does. It turns off automatically.
Okay, does it vibrate or light up to tell you to switch sections in your mouth?
I think it vibrates.
Okay, so does it vibrate every 30 seconds, 1 minute, or 2 minutes?
30 seconds.
Okay, so when it vibrates after 30 seconds, it's telling you to move sections in your mouth. So in the mouth, there are 4 quadrants. There's section 1, section 2, section 3, and section 4.
Okay.
So when this vibrates, quadrant 1, quadrant 2, quadrant 3, quadrant 4, to be specific, when this vibrates, it's telling you to switch quadrants.
Okay.
So when you're brushing, how many teeth are you brushing at a time?
I just kind of go back and forth across them all.
Okay, Mr. Rye, can you show me how you brush?
All right.
Okay, can you show me how you brush your tops? Okay. Thank you. You can set that over there. So, I noticed you're using a scrub brushing technique. That's a technique we call when you brush very fast, horizontally, scrub brushing. You're going all sorts of motions, going very fast horizontally. And that's not a super great method because that can cause gum recession, where your gums recede upwards or downwards, depending on the arch of your mouth. And we don't want that, and that can also cause tooth abrasion. I'm gonna show you a different brushing method than the scrub brush method. This is called the Bass method. The Bass method, you're gonna place the sides of the bristles upwards on your top teeth and downwards on your bottom teeth. Top is your maxillary, bottom is your mandibular. So you're going to place the sides of the bristles in the middle of your tooth And then you're gonna tilt the brush 45 degrees into your gum line, which is also called your gingival margin. So then you'll turn the brush on from there, and you're going to count 10 vibrations for each group of 2 to 3 teeth and do short, slow, circular motions. So once you've counted your 10 vibrations, you are going to overlap the toothbrush and move to the next group of 2 to 3 teeth and repeat and repeat and repeat all throughout the front, the facials of your teeth. And then when you are doing the backs of your teeth, which are also called the linguals, you are going to put the brush vertically towards the sulci, which is also the top part of your gums, gingival margin, and make sure you're getting the backs of your teeth, the linguals of your teeth, vertically. And now I'm going to show you how to do this. Okay, Mr. Eye, so I've given you a mirror so that you can see what I'm doing. So I'm just going to show you your back, your molars, and your premolars teeth, okay? I'm starting on your right side. So I'm going to go all the way back, and I'm going to position the sides of the bristles in the middle of the teeth, and I'm going to tilt it at a 45-degree angle, and then I'm going to go in short circular motions, counting 10 vibrations. I do not have your toothbrush on at this moment, so I don't spray water from your previous brush all over. And then when you move, you overlap those teeth. You do the same thing. Again, overlap. Again, overlap. Short circular motions, counting 10 vibrations. Same thing, because you want to get into the sulcus. And then when you do the backs of your anterior teeth, you're going to do this. Tilt your chin up for me. Same thing on the backs, linguals. And you're going to continue that all the way around the mouth. Okay, open slightly. And you're going to keep overlapping, counting to 10 vibrations. You're going to do the same thing on the bottom teeth. Like that. Overlap, 10 vibrations. And don't forget to do the back sides of your molars. Doing the same thing. And also the pits of your teeth. This is okay to do a scrub brush right here, and you can push slightly harder because you have all those grooves and pits. And then you're going to continue to do the same thing around the whole mouth. Now, I want you to show me what I just showed you. Okay, and I'm going to hold the mirror for you so you can see what you're doing. And I'm going to watch you do the same thing I just did. And remember to count 10 vibrations and overlap. And then when you brush, you can just do all of the fronts of your teeth, and then you can do all the backs of the teeth. Okay. If that's an easier way for you. That way you don't forget any spots on the way, and you're not just going back and forth butterfly methoding all over your mouth. But yes, that is how you would do the backs of your anterior, your front teeth. Okay, and then can you just show me the bottom so I can make sure you're doing the bottom correctly too? Yes, that's how you would do the backs. You don't have to go so hard and rough. Okay. Okay, Mr. Rice, now I've shown you how to properly brush our teeth. Just remember, you can do all the fronts of your teeth and then do all the backs and then all the fronts and all the backs. Just don't go from here to here to here to here to here to here. We want to keep a continuous motion to make the process smooth and easy. I wanted to ask you, how many times do you brush your teeth a day?
Usually twice.
Usually twice?
Sometimes I may only do it once.
Okay. When you brush, how long do you brush?
As long as the timer on that goes for.
Does it go for 2 minutes?
Yes, it goes for 2 minutes.
Okay, that's good. So we do want to be brushing our teeth for 2 minutes. That is ideal and good. But ideally, we want to brush our teeth twice a day. If you're only brushing once a day, you definitely need to make sure you're brushing before bed because you've had all the food throughout the day and you want to get all that off and not sleep in it. But ideally, we want to shoot for brushing twice a day. And the 2 minutes is great because this tells you that. Does this tell you if you are brushing too hard?
Yeah, it will vibrate, I think, if I push too hard.
Okay, that's good because when we push too hard, you're putting excess pressure on the teeth and the gum tissue. And again, that can lead to gum recession, which we do not want in the future. I also noticed your bristles look pretty good. Do you know how often to replace these, or do you just kind of replace them here and there?
I just replace it randomly.
Okay, so just so you know, we want to replace our brush heads every 2 to 3 months, or if we've been sick recently, or if the bristles are looking frayed, that means it's time to replace the brush head because we don't want to continue using a brush head that's old that may have harboring bacteria because then it defeats the purpose of cleaning our teeth.
Okay.
Other than that, great toothbrush. We've touched on improving our brushing. So now I want to discuss with you interdental care. Also, one more thing. Do we keep our toothbrush dry in a dry spot when we're done brushing?
Yes.
Okay, because we want to keep the toothbrush completely dry. Moving on, I want to talk about interdental care, which is flossing the in-betweens of our teeth, which are also called the interproximal surfaces, fancy words. Do you use traditional floss, string floss, or do you use the picks, toothpicks?
I have traditional floss.
Okay.
I don't like to use it, so I use these picks.
Okay. So when we use these picks, do we use the same pick for the whole mouth when you do this?
Yes.
Okay. Do you shove it in? Can you show me how you do this? Okay. So with these, Mr. I want to talk about these. These are great if you've gone out to lunch and you want to get something quick out of your teeth. But ideally, we do not want to be using these because you see the amount of string they give you. They don't give you very much floss. And when we floss, we're supposed to have a clean side and a dirty side because we don't want to continue putting the dirty side of the floss that just was in one tooth into the next tooth, because then we're just putting bacteria from one side into the next side. So these are not ideal, and then these are also very difficult to slightly wedge in without hurting our interdental papilla, fancy word for the gums in between our teeth. So with these, great for on the go for a quick removal, but these are not an ideal option to just do every day, every night. So with traditional floss, do you use the waxed or unwaxed, or do you not prefer?
I don't prefer, and I hardly ever use it, so I don't know.
Okay, so I'm going to show you how to use traditional floss. So with traditional floss, you don't need a whole yard. You only need 12 to 15 inches. And you have a clean side and a dirty side. So the dirty side, you have less on it because you haven't begun flossing yet, so you don't have a dirty side. Clean side, you have extra wrapping, so you can unwrap and add to the dirty side and use more clean. Does that make sense?
Yeah.
Okay. So, and when we wrap this around we wrap it around our middle fingers, and we don't want to wrap so hard that we're cutting the circulation off our fingers because that's just not comfortable and not ideal. Also, when you floss, you want to use your 2 index fingers to push between the interproximals of your teeth because these fingers give us more control, and that way with more control we're not causing damage or harm to our tissue in between. And you want to have about this shape so we look good. 1 to 2 inches right here for in between. So I'm going to show you how to floss your front teeth and your back teeth. I've handed you a mirror so you can see what I'm doing. So I'm just going to do a couple of your front teeth just to give you a visual. So I'm going to start right in between here, okay? So we don't have any dirty floss right now. I'm going to go slightly, wedge, 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 until you hear a click. Sorry. So gentle, and then you want to make sure you go in between 3 to 4 times. Then you pop it out. Now, that side of the floss is dirty, so I'm going to wrap this finger right here, and then I'm going to unwrap this right here. So now I have clean floss. So now I'm going to do the next tooth. Wedge, gently, 1, 2, 3, 4, and then go right next to it. 1, 2, 3, 4. Pop it out. Once again, dirty floss, clean floss, unwrap. And you're going to continue that throughout your whole mouth. So now I want you to show me what I just showed you. Okay, Mr. Rye, I'm holding a mirror for you to see what you're doing, and I just want to watch and make sure that we're doing this correctly. Gently. Okay, so I noticed that you have not wrapped the floss enough around the one side for the clean side and dirty side. So you need to have more wrapped around right here for your clean side and slightly wrapped for your dirty side. So like 1 to 2 right there, and then do the rest on this side for your clean side. Okay? And now use your index fingers. There you go. And there you go. Pop it in gently. 3 to 4 times. Go in between. Other side. Pop it in gently. 3 to 4 times. Other side. There you go. Now don't forget to right here wrap side for the dirty side and unwrap clean. So now you're using clean floss. There you go. Okay. Good. Pop it in yet. And then get the tooth next to it while you're still in there. Okay. Okay. Okay, Mr. Rice, so now that I've shown you traditional floss, do we feel better about that now?
I still don't like using that floss.
Okay, so are we not going to use the traditional floss then?
Probably not, no.
Okay, so I'm going to recommend to you there's a brand, Waterpik, which is approved by the ADA, Waterpik Water Flosser. Waterpik Water Flossers are pretty great. They're pressurized water, so you just follow the line of your gingival margin, the gum line, and to have ideal removement of debris, plaque, food, you should have it set at 6 medium. But when you first get one, ease into it because it's different than anything you've ever had. Water flossers are great because they go 6 millimeters into the pocket, whereas traditional floss actually only goes up to 3 millimeters deep. So to each their own, water flossers are pretty great. So I want you to look into a Waterpik water flosser if we're not going to use traditional floss whatsoever, because we want to be doing something because your interproximals were being missed with plaque, and we don't want that because we don't want to lead to potential dental caries, which can lead to tooth decay, and we don't want that. So
I'll get a water flosser.
Okay, so as I mentioned, I wanted to go over a couple more things. You have a toothpaste here. What kind of toothpaste is that?
This is a Clen Pro 5000 from my dentist.
Okay, so your doctor prescribed you this.
Yeah, I can only get it from him.
Okay, did he prescribe you this for a specific reason?
He said I had an area where I may end up with a cavity, so he gave me this to help with it.
Okay, so this toothpaste has to be prescribed. This is used usually to help prevent a potential cavity from coming if it's in the stage where it can be reversed. So, how long did they say you were going to be using this?
Probably just until the tube's gone, 6 months. Maybe I'll get another one at my next appointment.
Okay. So, yes, I would definitely go over with your doctor about this, about if he wants you to continue using this, or what your other options could be afterwards. Do you have tooth sensitivity?
Sometimes, yeah.
Okay, so a great option would be Sensodyne. Sensodyne is a great toothpaste that's been clinically proven to help with tooth sensitivity. The main ingredient is potassium nitrate, which is what helps prevent sensitivity in your dentin tubules. That's the dentin in your teeth. That's a layer of your teeth. So just make sure you go over that with your doctor for your next visit.
All right, thanks.
Mm-hmm. Okay, Mr. I do want to mention a couple more things. So when we did the disclosing agent and you saw the pink on your teeth, that's a sign of plaque, which is bacteria. So if you've noticed, it's still on your tongue. If you look in the mirror, your tongue is coated in pink. So our tongue harbors bacteria daily when we eat foods and have sticky drinks like soda, anything like that. Our tongue can harbor bacteria, pieces of food from chewing, which when the tongue's in your mouth, the tongue touches your teeth, you don't even know it, and that food can get stuck on your teeth and you're gonna have plaque on your teeth again. So something that you should incorporate is brushing your tongue, or you can even get a tongue scraper. Like I see that you brought a tongue scraper. These are great. So when you use that, how do you use it?
I place it on the tongue and just kind of scrub back and forth like this.
Okay, do you wet it?
Yeah.
Okay.
Yeah, I wet it first usually.
Okay, that's great. We want to continue doing that, or brushing works just as good. Make sure you're being gentle on the tongue, because all of those papillae, taste buds, however you want to call them, they're called papillae. They're sensitive and you don't want to damage them and then potentially lose taste buds or just damage your tongue. But we want to keep doing that because that's important. One other thing I want to mention is, do you use a fluoridated mouth rinse?
I have one here, yes.
Okay. Do you use that once or twice a day?
Usually once.
Okay, that is great. I just want to mention, if you are someone who struggles with dry mouth or anything, to avoid alcohol-based mouth rinses. Is that an alcohol-based?
I think this one is.
Okay, so do you have problems with dry mouth?
Now that I think about it, I probably do.
Okay, so I just wanted to mention that to you. Try to switch away from that. We don't want alcohol-based if we're struggling with dry mouth. Other than that, do you feel okay after everything today?
Yeah, I've learned a lot on how to better take care of my teeth and mouth.
Okay, that is great. I want to thank you for being my patient, and I appreciate your time.